Good morning, your Celebration Radio Network.
Hi, good morning. It's Dr. Salas-Rushford. I was supposed to call in and...
Yes, good morning. How are you?
Good morning. Pretty good.
Well, my name is Bill. The reason
right.
you are calling in is to talk about the COVID-19, you being on the front lines of not only in the United States, but I see here you've also been on the front lines in Puerto Rico and New York.
In Florida, too. I do have offices in all three states, but I did volunteer for almost 2 months in the ERs in New York State and Brooklyn. So, yeah, I was there going to be 10 days and ended up being almost 8 weeks.
Wow. So you were like right on the front lines.
I think it was the second busiest hospital in the area, actually. So
wow.
First one, Elmhurst in Queens, and then we were the second next to it. We had to put an outside tent to deal with the overflow patients and everything. So yeah, it was just giving a little help there, and it turned out to be a big thing.
Yeah, for 2 months. That's a lot of, I'm sure, overworked and obviously underpaid for what you guys do.
Oh, it was free. I didn't charge a penny.
Yeah.
I did it as a true volunteer, so I didn't get any payment or anything. United flew me for free. That's the only thing. They actually were nice enough to fly the first responders for free back and forth. But yeah, everything was out of my pocket, but it was worth it. As long as I can do something forward, that's how it needs to be, right?
Yes. Yeah. Amen. You don't hear that very often from people, so it's great to hear that. Now, what have you been doing to protect yourself? I mean, obviously being on the front lines and working with patients that are infected, is there a special procedure that you guys go through, other than like scrubbing down and things like that? I mean, are you around other people? What all has been going on with this?
We have to go back to basics. Like I was telling, a lot of people ask me, what do I have to do? It's better to do very little things very well than a lot of things badly or not that well. So, just starting from basics, from the face coverings or face mask is the number one thing, to secondly, just washing your hands. Keep your hands clean as much as you can and be conscious about it. Those two little things are really a key. It's like, I don't know if you heard the news that the first responders are the least infected in your state now by when they did all the tabulations. It's because we try to do very, very little things very well. So it goes from, wearing your face mask, being conscious to other people, to washing your hands, and then obviously as much as you can, keeping your exercise straight, your diet. And in my end, I deal with athletes, I deal with nutrition. I am very conscious about supplements and everything. So I do take my vitamin C, a mushroom extract like HCC, vitamin D, and measure my levels and try to, keep healthy in that sense, because at the end of the day, the only cure for COVID is your immune system to an extent. So as much as we respect our body, respect others, it's weird. It is a condition of our respect to others. If you take care of yourself, you're going to save who's next to you. So it goes a bit more than just medical knowledge. It's just respect out of humanity, I think.
Now, I noticed in the talking points, there's the immune supplements. You've already mentioned HCC. Now, is that other than that and vitamin C, are there other supplements that you would recommend? Well,
what I tell people is you need your basic vitamins. A lot of people go to the physicians when they're sick, right? And nowadays we have the ability to test through blood, saliva, different mechanisms, your vitamin levels, your supplement levels, and so forth, and your vitamins and things and metals. And I think that's something that now people are going to be more conscious to start telling their healthcare providers to check for them, and then you should tailor your input of supplements based on what your body needs, not just randomly taking things like that. Obviously, when it's flu season, those three that I mentioned, like vitamin C, HCC, and vitamin D, are great additions to, and those are things that actually have been proven to delay or actually decrease the length of the symptoms, which is what you want, right? When you're dealing with the flu, you want to be the less sick as possible and the less time out of work or out of your life as possible.
Okay.
So, yeah, now technology has changed. I think this condition has educated people to be more conscious about this part of their lives.
Well, I know that a lot of my interviews have leaned towards that with pharmacists and other doctors. The exercise, what you eat. I know it sounds like common sense, but a lot of people don't really look at what is in their medicine cabinet when it comes time to fighting something like this, a virus. We're taught, that there's no cure for, like things like this, and there's like the common cold and stuff. You can like mitigate the symptoms, but how important is it really to have a good regiment? I mean, I know I sound like I'm asking a really like, for lack of a better word, a dumb question. But how important is this? I mean,
not at all. The most common things. Like myself, I work a lot. I have several offices. I see a lot of patients. I have to be on the go all the time, as well as other people that have different lives and work. When you sit down, you realize a lot of the basic stuff. You really say, I'm going to do it tomorrow. Maybe I'm going to postpone it for the next day. And then you start lacking of energy, lacking of like you gain a little weight here, you don't sleep well there. It adds up. So that common sense that you ask is not a dumb question at all. It's like we have to sit down and see what's lacking in our lives and how we can arrange our life a bit better to take care of ourselves. At the end of the day, it's we want to keep healthy, enjoyable lives, and we're living longer. Now this disease comes, which is it's very rapid spreading. It's very dangerous, but at the end of the day, also very common things can help you fight it off. So it's one of those things that open the eyes to primary care, which includes, again, your exercise, your supplements, you're eating well, you're sleeping, which, at the end of the day, I was working night shift in New York City for, weeks on end, from like 7 p.m. to God knows what next day, what hour I could get off. And I wasn't sleeping when I was feeling really exhausted. So that part, even though I should know this, I was noticing, I have to rethink how I work, how I do things now. So, it's a very good question. And just basic things usually are not as basic. It's like I tell people, you have to check the tires and the air in the tires and check your car here and there. People just turn it on and go because I'm going to check it tomorrow. But those are the little things that can get you into trouble on the highway, and then you get stuck in a worse situation.
Right. Yeah, very good point. Do you think it's safe for cities to start opening up more than what we've seen? I mean, are there concerns and recommendations that on what you've seen that you would base that on?
Well, I can base that on medical knowledge. Obviously, I'm not either a politician, a statistician, or an economic guy. Mm-hmm. What I can tell you was my experience in the hospital. I had this lady, I think was Costa Rican. She came in. She must be in her early 40s with her kid. He was 10. I remember the age. He was 10. And they came in, the ER was packed, and she said, I'm like, you're like autopilot, like fever. And then she suddenly said, doctor, excuse me, like, why are you here? Like, I'm hungry. Like, what? But you're here in a COVID-infected. Yeah, she was really hungry. Wow. She was laid off 3 weeks ago. She looked not well, but she was honest. She was nice. She was this very elegant lady, and she was ashamed to be there because she couldn't feed her child. Like we ran out of food. The unemployment hasn't kicked in, and we're really hungry. So we came to the ER to look for food. And obviously that broke my heart. It was like we stopped everything. So you have to outweigh sometimes how can people behave better or act more united in this front of everything from medicine to getting along with each other and maybe opening. But if you're more conscious, you can open in a more informed way. And then you'll be able to let people like her be able to work again. Yeah. So it's a very delicate line. What do you want to do? Keep everybody in their homes, and then some people are going to really suffer. The kid was, I knew he hadn't eaten in a few days. It just looked that way. He was dehydrated and everything. So it's a very delicate topic. I think, yes, we need to start living again, in a sense. That doesn't necessarily mean we need to go to the amusement park and jump around, right? But we need to start living and being conscious about who's around us and how can we put a little of our good faith or good humanity forward and know that this is happening. I'm lucky I have work. You're working, right? Yeah. But not everybody is as lucky as us.
Right. Yeah, I'm one of those like you as far as the category, an essential worker, because I'm in radio and you're a doctor. So, I haven't had any days off. I work 6 days a week normally anyway. So it's just, I really haven't felt the crunch as far as staying at home. Now, my daughter, who was working, is not working, and she hasn't worked since January. So she, on the other hand, is at home and almost pulling her hair out. So there are families where, they haven't left the house except to, get groceries and things like that. So, being able to open up again.
It's interesting with this disease. I've been through hurricanes in Puerto Rico. Like, I've lost even my apartment. I've been through all that. I've been scrambling for food when the big hurricane came here a few years ago. But when you have a natural disaster, you can go out and help. And maybe those people are employed, or myself can have a purpose, right? We can go out and give her a hand. In this disease, not even that. You feel useless. It's a very different way of mental sanity, if you know what I mean. That when you have a natural disaster, obviously I don't want a natural disaster. I've gone through quite a few, and I don't want to go through that again.
Right.
Obviously, it's not in my control, right? But if it were, I wouldn't want to be there again. At least you can go out and have a purpose and help and keep occupied and your mind occupied. But here, what they're asking, stay home, which is correct. But then you have that mental health that goes into play of how people are going to tip over very quickly because, not everybody, at least in New York City, like I was staying in a 10 by 10. When you live in a small studio and you're there for 3 months, it comes to a point that you don't want to see that wall anymore.
Yeah, very, very true.
It's everybody thinks we have a backyard. Everybody, a lot of people assume that you go out and have a driveway. No. Some people live, 3 to an apartment.
Yeah.
And it's tough. I don't know how else to describe it in a way, but it's not pleasant to a point that you might need air, need to do something. So,
well, another question for you would be, obviously they're saying that the COVID, it's not done. We may get hit with another bout of it towards the winter time, and it could be even worse than what this was. And so what can we do to get our immune system into shape now? As a former athlete myself, training was, part of a daily lifestyle, running 3 to 5 miles a day, lifting weights, practice. I was a football player. So, there was a lot of, running back and forth and training the body to play that 60 minutes of football, those 4 quarters. So this, on the other hand, this is not like that in a way. So what can we do to get our immune systems into shape now? I mean, it's better late than never, I guess.
Yeah, I think now it's I'm not going to say easier, but I think the word that comes to mind is easier because now we have more knowledge of how to act, right?
Right.
When everything started, we were afraid, and I think we need to take that fear out of the equation and respect the disease and respect our colleagues of humanity. Now that we know how the virus acts, now we know what lessons we learned because I think that's wave 1 was about lessons, but learning, take notes and learn, and we did learn. At least I hope people learn. I as a physician learned a lot. So, I can tell you what I've learned. Like, I'm going to take better care of myself, sleeping better. Obviously, a personal note, I ran out of vitamin C, and I've been taking the mushroom extract, the HCC, and my dad did too. We didn't get anything. My mom got COVID. She got really, really sick. So I was, to the point of like almost losing her. And I brought everything I needed. I supported her for 10 days, and she finally kicked it out. So I was blessed enough to still have a mom, right?
Yeah.
So I'm fortunate for that. But she never took it, and she got it. I can only attest to that. So, and my dad would walk with me and everything. So it's a matter of like what takes priority, like how to take care of your body. Now look at how much time we had and how much time we have right now, because a lot of things that were needed, we forgot about them because we were home, right? So let's spend our time, money, and effort, and just being nice, doing exercise, sleeping well, and eating. Like, there's no shortage of food. Like, we can actually go and buy groceries. Yes, we have to wait in line, whatever, but we can actually buy good groceries and cook at home and maybe save some money there and maybe use that money to get the appropriate things. Get a better pillow, it's little things, but those things can really make a difference.
Great points. Wow. What a fantastic that your mom recovered. That is so great. Not everybody's moms did through this, and I just want to say how grateful I am for you that it did work. You guys were able to get through that. So, like you said, what a blessing.
It's one of those things, that even me knowing everything that I knew, it was a point of what can I do more? Because obviously we think we know about the condition, yet we don't know all the things, but we know enough now to be able to make better decisions. Like how I practice with COVID patients today is very different from like 3 months ago of everything that I learned, right, in the trenches, what we call them in New York City. So as long as we learn from our mistakes, we should be able to move forward. The bad thing would be we didn't learn what we just lived through, which I think it was a pretty good lesson for everybody.
Yes. A lot of people have, I'm sure, have learned a lot of, like you said, the basics. A lot of people, they like you, the analogy of the car, getting on the interstate with, not very good tires, or maybe your radiator's low on fluid and you live in the desert. That's never a good thing. My car actually overheated almost yesterday. So, so it's, when you're living in 113 degree heat, in, Arizona versus, the cooler temperatures back east, but with the humidity. So your body has to learn. And I've been living here for almost 20 years now, so I'm acclimated to the desert. Now, when I go back home to Wisconsin, the humidity just gets me. So, it's training your body, and I know that you're the director at Fit Body MD. Tell me a little bit about that. What is that all about?
So, I did train internal medicine. I'm a traditional trained doctor, but I've been a runner. I ran professionally too. So I started treating very early on athletes and trying to see how can I fine tune them, right? Like a good mechanic. Before I was a doctor, I was a car mechanic. That's how I paid medical school. So how can you take a normal car and I don't want it to race and destroy the motor, but how can I make it more efficient with little things here and there? And I noticed that we can treat the human body the same way, get good lab work, and actually fine-tune the body to be more efficient, to sleep better, to perform better, to recover better. This is not about like doping or overdoing superhuman people. No, it's about how can I make your body a bit more efficient? How can I identify things before they actually happen? How can I learn from labs if you are going to be diabetic or pre-diabetic before the actual sugar goes, whack? And athletes are high-tuned machines. Like an athlete uses so much nutrition, uses so much of the natural resources. And one of the things is how many professional athletes have you seen they growing older? A lot of them, unfortunately, they die very young because they overuse their bodies and they don't put back what they've taken out. If you think about it, how many real professional athletes you see in their 80s or 70s? Rarely any.
Yes, very true.
And I wanted to see how can I get medical science instead of treating disease to improve health, if you know what I mean. Mm-hmm. So it's the same thing, but a different perspective. I can improve health versus curing disease. And I was noticing that all my patients were actually running better, enjoying better. And now I've been, more than a decade what I've been doing. So some of the retired, I see they have a better, enjoyable life. They make their money, they have their family. Now they need to enjoy it, right? Being an athlete is
exactly.
A great sacrifice. So how can I get medical knowledge to help you out? So what I tell patients that I treat health, I improve health, I don't treat disease. So I see, I always see people when they come to my office as an out-of-shape athlete versus somebody who's sick. And that really takes my mind out of that disease state of like negativity and put it in more positive state. How can I, he got out of shape, how can I make him better? Not only physically, but emotionally. When you are healthier, you actually think clearer, you treat other people better, you feel better about yourself, and you're more efficient, whether in your work, your job, whatever you do.
Okay. Well, that sounds like, basic stuff, really, but yet I'm sure there is a lot of science behind that as well. The human body is, God created it to be, quite amazing to what it could overcome. So with fighting flus and infections and colds and all of this, the supplements, I believe that there's a lot of stuff that we haven't even tapped into yet as far as, supplements and herbs and herbs and all of these things that are out there that we have no idea what there could be the cure for every type of cancer in the rainforest, so it's an amazing thing to help people with things like this, and Fit Body MD medicine is it sounds like it's on the cutting edge.
Well, we try. It's just now, like when I started 16 years ago, medicine was not as clear or as affordable or as reachable as now. Now there's a new generation of doctors that truly believe, like now, like if COVID came 15 years ago, nobody would be thinking about supplements, is what kind of drug or pharmaceutical we're going to give the person. And now we are realizing that the best defense against this deadly virus is our own immune system. Mm-hmm. So figure that one out, right? We're trying to create this perfect drug versus we had it inside of us all along, but did we take care of it? Maybe not as we should. So now it's this good balance, which is good. It's opening everybody's eyes, even myself, to how can we make people in a better state. And people said I didn't have the time. Now, for me, time, the concept of time has completely, I rethink the concept of time after COVID.
Yeah.
It's a whole different thing now.
I'm sure a lot of people have, yes. Spending time with the family now is almost not even an option anymore. So, you got time to do that. You have time to do a lot of things that I'm sure a lot of people have put off, and hopefully, the procrastination effect will dwindle to non-existence. So, people I'm sure are still putting off things that they could do today, but hopefully that is getting less and less every single day. So. And
it comes back to basics, being good human beings. So if we can be good human beings and we understand that indirectly or directly we're going to affect everybody and COVID is going to affect us in somehow, then it makes perfect sense how we need to behave, how we need to act, and how we need to guide ourselves. And for this one and how many other pandemics we're going to see in the future, there's nothing we can control. It's just how it is and how we can't control our circumstances, but we can always control how do we react to them. And as we react to them is what defines us as humans, right?
Yes.
That differentiates us from an animal.
Yeah.
That just out of instinct, we don't. We can think and we can actually foresee what's going to happen to us and to other people.
Well, it has been a great opportunity for me anyway to talk to you today, Dr. Jaime, and I really appreciate your time and all your insight into the human body and what makes us tick. I do appreciate that, and the supplement advice as well, and sleeping better. Everything that you said this morning has been great, so I look forward to sharing it with my listeners.
I always try to put in my Instagram some basic good stuff, translate the very complex jargon of medicine to basic stuff, so you can follow me at FitBodyMD, and I always try to put good motivation, athletic things, so people can actually benefit from everything that we do with athletes. For the our average. Now we're commoners, right? Once we leave the professional league, now we're part of the group.
Yes.
But it were good times. The athletes know what I mean.
This is true. Why don't you give us your social media platforms that we can get in touch with you on?
So Instagram is FitBodyMD. That's what I have. So very simple. FitBodyMD.
FitBodyMD on Instagram. Well, again, thank you. I sure appreciate your time, and thank you for all your hard work in helping the United States get back on its feet. And again, very thankful for your mom's recovery, and God's blessings to you and your family.
Thank you, and thank you for having me, and please count on me for whatever you need in the future.
Will do. I appreciate it. Thanks.
Thank you.
All right, bye-bye.